Maybe this guy's like cut up or something.
Sure is.
Yeah, that is the bladder. Usually it looks a little bit. So that's the bladder there, and then with the. Yeah, they look, and then this one with the girl, that it looks a little bit smaller. That's the bladder right there too. So that actually is kind of big. The seminal vesicles are. You see this and this, these little red things right here?
What's that thing in between them?
I can't see anything right now.
This is actually, see, this is the large intestine right there. So this is that's like food in the large intestine. Yeah, that's pretty gross. So yeah, those are the seminal vesicles.
Where are they?
A lot of things are a little bit bigger. The seminal vesicles. So it's kind of like behind the bladder. Yeah. So here, this is the bladder. This, and this.
Okay.
There's two of them. Those are the seminal vesicles.
And then, so on the testy, which is easier to see on this guy, he's like hanging out right there.
This
that's
guy.
the epididymis right there, and then the vas deferens is the tube?
Yes, exactly.
Okay.
Wait, so what?
This is the epididymis, this part that's like attached to the testes.
Okay.
And then this, so in like the testes is where the like immature sperm are being made, right? And then they go to here, the epididymis, and they mature, and then they leave this tube to leave the body. This is the seminal vesicle right here. And then that meets up with, this is the vas deferens.
Right.
And then that meets up with the seminal vesicles, which is actually producing like the semen part, and it joins in the picture. You can see it joins right there. So that tube is this tube. You have this.
Right.
You have this. And then that you can't see the lower urethral gland. And really the like. That's probably all you can see. Because like the urethra and the penis gets like cut. You can't really see it.
It's not that thing that's like folded over, right? Like, isn't it this thing?
Oh yeah, that's it. Right.
It's like bent. Ew.
What is that?
That's the penis.
Alright. The Peter.
And then on the girl, you have this right here, and up here, those are ovaries. This is the fallopian tube. This is the uterus where the fallopian tubes join, right? The fallopian tubes are bigger than you would think, but the uterus is really kind of smaller than you would think. Sometimes we get pregnant ones, and it's really weird because they're really, they actually develop in the rats. Part of the reason I think that the tubes are big is because the babies like develop in the tubes more than the uterus. So I think they just use them more than we do.
Well, how many? Don't they have a lot of babies? I can't imagine.
They kind of like
little babies.
you see them like boom, 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 like bumps.
Oh my gosh, that's weird.
Super weird.
And then
the endometrium is the inner lining of the uterus, so you can't really see it. And then the cervix is the
between the vagina and the uterus.
Right. So you also can't really see it because it's kind of like inside. It's the very bottom of the uterus. And then you can't really see anything else.
And then bladder, and then just the bladder stuff in the kidneys.
Yeah. So the bladder on the female is just this thing right here. The kidneys should be really pretty obvious here. And then the ureter, there's a lot of connective tissue, so you can't really see it, but
if you were to
looks
put
like
a thing
that
in there,
too.
it would just be like, what is the tube width?
Yeah.